This was my identity.
Nobody talks about how freaking hard it is to be a dentist. What most people talk about is how this affects the patient. What nobody talks about is how this affects us. Dentistry is ready for this. Now is really the time. Welcome to Wellness in Dentistry. Today we're going to be talking about the mental game of difficult patients. And if you're a dentist or a team member or a hygienist or somehow involved in dentistry, you have had these nightmare patients. And we're going to talk about how to deal with them, how to set expectations with them, how to make them know that they should be the ones that are paying for the revisions that are happening. So my name is Dr. Kyle Stanley. I'm a dentist, tech entrepreneur, speaker, and researcher, and I'm joined by my very good friend and my co-host, Dr. Martin Mendelson. Martin is a disabled dentist, coach, speaker, and author, and his first book, One Move Makes All the Difference, is available wherever books are sold. Together, Martin and I have helped thousands of dental professionals pursue wellness in dentistry through our online courses, our in-person courses, our private coaching, and everything that we do together.
Mhm.
So, Martin, let's talk about this difficult subject.
Yeah, it's certainly a challenge, that's for darn sure. I think the first thing I want to say, which we didn't talk about in our pre-recording huddle there, is can we just all remember that people do the best they can with the skills they have at the time?
Yes.
Can we just start there,
Yeah.
right?
It's a good place to start because
Yeah.
I loved to blame myself. Like, I
Hmm.
should have done this, I should have done this, I should have done this. I was shooting all over myself as I learned from you.
Yeah. That's a Gary DeWoodism.
Yes. And it's easy to look back in hindsight and say, I
Yeah.
shouldn't have said this to this person. I should have set better expectations.
Hmm.
So yeah, I really like that. We
Yeah.
all do the best we have with the skills. Wait, what is the expression?
We all do the best we can with the skills we have at the time, and that
Right.
includes how they're reacting and interacting with you, and includes how you are reacting and interacting with them.
Mm-hmm.
So, because we're both humans, last time I checked.
Yeah.
So, yeah, that's a
Yeah.
big deal.
So I want everybody who's listening to think of their biggest problem patient.
Hmm.
Okay. And I don't know, Martin, if you can think of
Oh
one
yeah.
you
Oh
have.
yeah.
Yeah, he or she comes to
Oh
mind.
yeah.
Uh-huh.
Yeah.
And I want you to think, and maybe you and I can talk about our problem patients that we have in our mind. What was actually the problem?
Yeah, you took the thought out of my brain. Yeah, it's uh to quote another mentor of mine, Jim Barley, it's the thing behind the thing. And
Hmm.
so, people are reacting and interacting based upon something else that's going on, and we don't know what that is. And because everybody is dealing with their own struggles, they may react to a treatment plan proposal because of money, because they know their spouse is about to get laid off or whatever, but they never told you that, right?
Yeah.
And so all of a sudden they become nasty and combative and they're questioning you and asking for a second opinion and has nothing to do with you. It has to do with their fear, right?
Hmm.
But there's no way for you to know that, right? So then how do you react and interact based on that situation? So yeah, there's so many layers to this.
I think for me, when I think back at my problem patients, yes, some of them were difficult people. They
Mhm.
were difficult personalities, but I'm going to focus on what I could have done differently.
Yeah.
And there was a lot. One patient I can think of, she was a successful med spa owner in
Hmm.
LA,
Hmm.
and she came to me with implants on the top, but a denture over it, and she had failing dentition on the lower.
Hmm.
And what we were planning on doing was extracting the lower teeth that were all hopeless, placing implants, attaching a fixed hybrid on there, and then doing the same thing on the top on the implants she already had.
Hmm.
Okay. And I went through everything you could possibly think of with smile design and guided surgery
Hmm.
and, immediate provisionalization and great occlusion and everything. Well, she didn't like it when it was
Yeah.
done. We did immediate temporization on the lower implants. We did immediate temporization on the upper implants. And she came back the next day and said, remove it. And I said, I can't remove it,
Right.
especially the bottom, because those implants are brand new.
Yeah.
And she's like, I don't care what you have to do. Take it out of my mouth. I don't like it.
Mm.
And I compromised and I took the upper off because those implants were stable. I put her denture back in and had to readjust the upper denture to the lower provisional that weren't made together.
Mm.
Okay. That next day, she sent us a certified letter, or maybe
Hmm.
in the next 2 days or something, that basically said, I want all my money back.
Yeah.
And as you can imagine, this was an expensive case. We're
Yep.
talking 70,000, something
Yeah.
like this,
Yeah.
sedation, the whole thing. Um, and I really lost it. Like this
Yeah.
was and it was one of the three events that really threw me into a whirlwind of burnout.
Mhm.
Now, was she difficult? Yes. Um, were her expectations unrealistic?
Hmm.
Yes.
Yeah.
But I also was poor at setting expectations with her.
Yeah.
So I needed to be way more upfront with all the complications, how long she had to wear provisionals for.
Yeah.
She also kind of pushed me to go faster. I should
Hmm.
have had better
Hmm.
boundaries and communication on
Yeah.
doing the structured way that I always did things.
Yeah.
And so it's funny when as much as I would love to blame her for being a challenging person,
Hmm.
there were things that I definitely could have done better.
Yeah.
And since that case, I did learn skills. I
Yeah.
created a whole concept called the complication compliance method and treatment agreements and all of that.
Yep.
And now we use in my practice daily, and we have much less of these problems.
Yeah. 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 It's, because I've heard you speak about this in Lightside Live too, because we touch on this and, the idea that it's like you have to talk about this stuff every single time because the one time you don't, that's when it's going to come and bite you in the rear end. And
Yeah, this is the annoying part of
yeah.
dentistry, right? Is
Yeah.
do we have complications? Yes. Do complications happen all the time? No.
No.
When you think about it, what percentage are complications? 2,
Yeah.
maybe 4% of the
Yeah.
time? It's less than one out of every 20 people. I mean, some could be one out of 100
Yeah.
for certain procedures.
Yeah.
But what that means is you have to talk to each one of those patients as if it's going to happen
Yeah.
to each one of them.
Yeah.
And why this gets people in trouble is because they think that talking to patients about complications and
Hmm.
revisions
Hmm.
is going to reduce their case acceptance, number
Yeah.
one,
Yeah.
and that patients are going to leave.
Yeah.
And I'll tell you, that may be the case, but if they do, you don't want to treat those people anyways.
Right.
They're the
So,
ones that are going to turn into these nightmare patients.
yeah. So you talk about difficult patients, the one that leave. So there's you've heard me tell this story before, but there's three people that I remember, three patients that I remember related to being extraordinarily difficult as a new patient.
Oh.
And I was kind of I was, a newbie dentist. I don't know where this came from because, I had none of this training back then. But they were new patients. Two of the three were in pain. They were just nasty.
Hmm.
And somehow, somewhere out of the recesses of my mind, I got this idea. And I did it once, and then I did it two other times subsequently, years apart. But what I did was, after the most recent nasty statement, I sat them up as they were sitting up. I made a big thing, flourish of taking off my gloves, putting it on the bracket tray with a noise. And I looked at them and I said, listen, I said, you and I have never met before. I said, and you're here today for X. My role, I didn't say job. I said, my
Hmm.
role
Hmm.
is to help fix that.
Hmm.
And then I paused and I said, where is all this hostility coming from?
I
And then I
love that
shut up.
line. I love that line. I just
Yeah.
used that line the other day. But keep going with your story, but
Yeah.
I'll tell you.
So one of the three left.
Hmm.
One of the three started crying. And
Mm.
the third just admitted that they were being, excuse me, a jerk. Oh, I was going to say something different, a
Hmm.
jerk. And it bartered a new relationship. Now, the one that started crying, we ended up not being able to do treatment because the individual had so much going on in their lives. But it was what did I do there? What I did there was I became curious
Hmm.
and I started asking questions. Now, it
Hmm.
was a very simple question. Where's your hostility coming from?
Hmm.
But it was a simple question. So, because we get so caught up in the people pleasing element of dental practice, which, look, let's call it what it is, that, we have to be customer service minded. That's very important, right? But we don't need to take shit from people.
Yeah.
And so if someone's being difficult, there are those clinical cases, but how true is it that 9 times out of 10, nah, let's make it 8 times out of 10, it's something financial, administrative, something non-clinical, 8 times out of 10, right? So, going to crucial conversations, the book, the framework, etc., that will set you free because it gives you the opportunity to start with facts without editorializing, making it safe, et cetera, et cetera. And then, you can go back to the facts and basically look at this person in the face and go, listen, given the fact that we did this, this, and this, and this, and this, I feel like we've done everything that we could for this. Like, what is going on with you? You know,
Well, it's funny when you talk about that little discussion that you had with those patients, it's kind of a mini crucial conversation, right? You said
it
like
is.
one fact at the
Yeah.
beginning, and
Yeah.
then
Yeah.
you finish with a
Yeah.
curious question, right?
Yeah.
So it's like a
Yeah.
tiny, like a micro
Yeah.
version.
Well, one that I didn't handle well, also when I was young in practice, it was a really big guy, muscular, and he was a very heavy bruxer.
Mm,
And the dentist who retired, whose position I was taking, had made him a night guard, and
hmm.
he cracked it like 3 times.
Yeah.
And he came in and he's like, "You need to replace this." And I looked at him and I said, "Why is that?" And he goes, "Because it broke." And the reason why I feel I didn't handle it well is we kind of went round robin. Like it was a very circular discussion, right? And I didn't have the self-confidence to be like, not that I would say it this way, but I didn't have the self-confidence to look at him and go, you're wrong. But it just became I was trying to be too pleasant about it, or pleasant's the wrong
Hmm.
word. I was trying to be too soft in my language, right?
Yeah.
When what I should have said was, why are you wearing this? Well, because I'm grinding my teeth. Well, what happens if there isn't anything there? Blah, 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 blah,
Hmm.
blah. So you're breaking this instead of your teeth. Which would you prefer? Right.
Yeah.
So I wasn't as forward as I could have been.
It's a
And I
bumper on your
regret that.
car, right? The bumper
Yeah.
gets smashed, but you're still alive.
Yeah. I did use the tire analogy, but that didn't
Uh-huh.
seem to work on him. Yeah. It just didn't work.
In your story, you said that one of your patients left.
Yeah.
Oh my gosh.
Yeah.
You lost a patient, Martin. Can
And
you,
you know what everybody
you're
said?
still, oh my gosh. And you
You,
continued to practice after that.
you know what everybody said?
Thank
No
God.
joke, including the practice owner who
Hmm.
overheard everything. He goes, "Man, I'm glad she left."
Hmm.
Right?
Well, that's the thing that I want to get across is not every patient is right for your practice.
No.
And one patient, even many patients are not gonna, leaving are not gonna destroy your practice.
Yeah.
Earlier today, you and I were on for our Light Side Club and we were talking about one of our friends, Don,
Hmm.
who is in Fresno, and he's mentioned that I could say his name and tell his story. He lost about 50% of his
Yep.
patients because
Yep.
he went out of network.
Hmm.
And everyone listening is like, holy crap, if I lost 50% of my patients,
Hmm.
I would be done for. My
Yeah.
practice would go under, I would feel like a loser, all this stuff. Don lost 50% of his patients because he went out of network with insurance. He's making the same amount of money
Yep.
doing 50% less work.
Yep.
If I came to anybody listening to this call and said, would you rather make the same amount of money doing the work that you're doing now or 50% less? Unless you're a total psycho, you're going to
Yeah.
say, yeah, I'd rather do less work and make the
Yeah.
same.
Totally. Totally. Totally.
And this was such a hard learning for me. I
Yeah.
wanted to please every patient.
Yeah.
I would bend over backwards to do anything that I could to make
Yep.
patients happy, all so that they wouldn't leave, also that they'd do treatment with me. And I'll tell you, it's very freeing when you get the mindset around you don't need every patient. Not every patient is right for your practice.
Yeah.
And it's better to set the expectation, the boundaries at the beginning to see if they're the right patient for you. It's like if you're dating
Yeah.
and oh, well, I don't want to talk to see if he or she wants kids because, I don't want to kind of scare them. But if you want kids, don't date someone that doesn't want kids,
Right.
like,
Exactly.
or,
Yeah.
vice versa.
Yeah. And two other things that are rattling around my brain. Number one is um, when it comes to difficult patients, how they treat your team is how they treat you. And what I mean
Mhm.
by that is you cannot allow people to treat your team in a way that's any different than they would treat you. Now, we know that this occurs with some nuance, and that's not what I'm talking about. What I'm talking about is someone who's rude, who's nasty, et cetera, et cetera. That kind of behavior is is a culture cancer of great proportions that you may not even realize because the mental cost of your team seeing that you're allowing Mr. and Mrs. Jones to talk to them like that will cost you more than you ever will know.
So true.
So that's the first thing I would say. The second thing I would say is this, and this was a very liberating for me as a person. So here it is. You ready? I don't like everyone. Why should I expect everyone to like me?
Yeah.
I'll repeat
So true.
that for those in the back. I don't like everyone. Why should everyone, or why should I expect everyone to like me? It's a very freeing thing when you
Hmm.
really accept that. And that goes for patients. So,
Yeah. What percentage of the mental game of difficult patients is on the patient versus on the dentist?
ah, give me greater clarity on your question because I could go two different ways with that.
Well, I want to ask you this without answering the question.
Ah,
Um, Let me just answer the question, or let me just
okay,
tell you my thoughts on it.
okay.
We can't control other people,
No.
right? We can't control what their background is, what their
Mm-hmm.
thoughts are, what their fears are, what their relationships are, what their finances are.
Yep.
All we can control is what we do,
Mm-hmm.
right? And all we should focus on is what we could do.
Yeah.
And I think so many of us, and this was me early in my career, was we focused on the other person. Oh, that person's a bitch. Oh, he's an asshole.
Mm,
Like he's this and that. Well, that may be true, right? They may be totally,
yeah.
they may suck as a person, but let's focus on what we could do. We could set boundaries with them. We can
Mm-hmm.
set expectations with them. We can be better at communicating with them. We can,
Mm-hmm.
change how we present treatment to them. That's all we can do. Now, if they're still an
Mm-hmm.
asshole after that, guess what? You've done your best.
So what I would say to that is it's my team framework and it's the core of the philosophies in my book where um the core of my book is a quote attributed to Viktor Frankl, which is between stimulus and response there's a space. In that space lies our freedom to choose our response. In our response lies our growth and our freedom. So the fact that the patient is an asshole is neutral. It's your
Right.
thought that drives your emotion that creates action or inaction that manifests how you deal with them, how you don't deal with them, and or how you're thinking about them when they leave. And so, if you're looking for more in this realm, which is based on a lot of behavioral research concepts, pick up my book, which, by the way, you can also get 4 hours of CE for reading my book as well.
Which is awesome that you
Yeah.
have that. I don't know very many
Nope.
books that
Nope.
you can get
Yeah.
dental
It's
CE
very
for. So,
unusual. But
yeah.
it's because of all the research in there
Yeah.
and the exercises and all the stuff in there. But the
Mm.
point is that you're the one, and this is very simple, but it's not easy, folks. You're the one that creates your thoughts that drive those emotions that are going to ultimately create your actions. So here's my recommendation, my proposal. Often when you hear behavioral scientists, therapists talk about emotions, they guide you to think about emotions as like if you're sitting on the side of a stream and they're kind of just rolling by. Like you are not the voice in your head, you're the one who hears it, to quote
Mhm.
Michael Singer. So the idea is like you're observing your emotions floating by and you think to yourself, huh, I wonder why that is, right? So if you can start to flip your internal mental script from, oh my God, I can't believe they just said that, to, huh, I wonder why they said that. It's a huge difference. It's very simple, not easy. And it's a journey, not a destination. This
Yeah.
stuff takes time, but when you start to be more curious, it not only takes a less of emotional toll on you, but I'm telling you right now, you're going to find out stuff, the thing behind the thing, more than you ever imagined because you're actually asking the question instead of reacting. It's a huge step. It's a huge thing.
I'm on that journey and I'm not always great at it, but I'll tell you when I am, it's a
Yeah.
game changer for me.
So let me tell you a story. I haven't even told you this story yet. I alluded to it, but so I gave a presentation at a tech conference. I was one of the headline keynoters.
Yeah.
And I had my banner and I had some additional books. We sold about half the books I shipped in, which is great.
Nice.
So I was checking out the next morning. The evening before, I said to the bellman, can you please hold these three boxes, two boxes of books and a banner? And I'm checking
At the
out
front,
tomorrow.
kind
Okay,
of, or
fine.
wherever they hold it.
Yeah,
Hmm.
great. Go down to check out. By the way, I was meeting a very dear friend for brunch. Can't find the boxes. Like, what do you mean you can't? Where did they go? This is like $2,000 worth of stuff. It was like 72 books and a custom-made banner that your uncle-in-law made for me.
Yes.
Um, they can't find them. And was I upset at first? Of course I was. But what did I say to myself? Martin, I'm not making this up, by the way. I said, Martin, what do you want to do right now? I just want to get my books. I want to get my stuff. Great, Martin. Then what do you need to do right now? Well, I need to get these people to help me. And I swear I then said, so how do you want to do that? And I said, with calm and kindness. And that's what I did. So in the end, they couldn't find them in the I was there an hour, Kyle.
Oh my gosh.
Ended up interacting with the general manager, who was a lovely woman, who I gave a book to, by the way,
Hmm.
who committed to find them. She then found them, gave me 50% off the room. I then ended up not paying for shipping to go back. So I ended up netting $700 to $800
Wow.
because I didn't get upset and because I
Yep.
wasn't an asshole.
Hmm.
Because could this woman change the fact that the boxes were not in the storeroom? No.
No.
But could I be in charge of my own emotions and reactions? 100% yes.
Hmm.
100% yes. So that's just a small story. By the way, there's lots more to it. It was crazy what happened. But this, I could have been that difficult patient and I chose not to. And she actually looked at me at one time and she said, Sir, you're being so reasonable right now. And I looked at her and I said, why else? In what other way would help us resolve this problem?
Yep.
I said, you didn't do this to me on purpose.
Yep.
I said, so why should I be an asshole? I said, that's not going to do either one of us any good. So I was on the opposite side that day. So
I had a different situation, but still a situation that required me to focus on what I can control
yeah.
the other day at the DMV.
Mm.
So I can't remember if I told you, but we
No,
got,
we chatted when you were there, but you didn't say,
oh
yeah.
yeah, yeah, yeah. So, but you know that we got a newer car or a new
Mhm.
car to us, not a new
Yeah.
car, but a new car to us.
Yeah.
And it's from out of state, which I've never bought a car from out of state before.
Oh, that's a whole, yeah,
And
I've done
so it's
that.
a little more challenging. You can't really do everything. Like
Yeah.
usually I can just go into AAA and do it and it's very easy. I had to go to the DMV because they had the bill of sale and all that stuff.
Yep.
So I looked online and looked at what I needed to bring. I thought I had everything I needed to bring. And I go in, I go there early and I wait in line and I'm there for like 30 minutes. And there's a very nice lady that was helping me. And she said, okay, well, you have to pay this amount of money, which was a crazy amount of money, by the
Oh,
way,
I'm sure.
for the
Yeah.
taxes in
Yeah.
California. I think we have I see why everybody is committing tax fraud and having their cars in Montana, right?
Yeah.
I wish I had more balls to commit fraud like that, but I don't. And it turned out that I still, after everything I had done, I spent 2 days on this. I still had to get a smog check on this car because it's from out of state. And what was the other thing I had to do? Oh, and I had to pay with a cashier's check.
Oh, geez.
And so I was like, gosh, I wasn't planning on this taking an entire day,
Yeah.
but I was very nice to the lady. And she said, I'm really sorry, but I can't complete this as it
Yeah.
is. And I was like, okay, well, not your fault.
Yeah.
And I was very nice to her. So I spent basically the rest of the day, besides going to jujitsu, going to the bank, getting this cashier's check, going to the smog place. They had a big line, waiting in line, trying to get work done while they're doing that. Came back and I get in line again, and there's like 100 people in
Oh,
front of me
God.
in line. So I
Oh.
called my wife and I'm like, I don't know when I'm going to be home today, but I'm just going to try to get this done. She's like, okay, no
Hmm.
worries. I'll get the kids and whatever. And so I'm there for maybe 10 minutes. And I set up kind of close to where that lady's window was, not thinking she would take me again because there's so many different windows. And I'm there for like 10 minutes and she goes, Sir. And I look and she goes, Come here. And she pulled me out of line and
Oh,
goes,
wow.
Listen, I see you're ready. Like, you have all the stuff you need? I'm like, Yeah. And she said, You were so nice to me this morning. Not very many people are nice to me.
Ah,
And it made me feel so good. Like, first of
that's
all, it
amazing.
saved me at least an hour. I mean, maybe two
Totally.
hours.
Totally.
And it just shows that, like, if you can control your emotions,
Yep.
that is a superpower.
Oh,
Because
100%.
both times that I was at the window with her,
Yeah.
people next to me were
Yeah.
pissed off. Well, on
Yeah.
the website, it didn't say this, and I
Yeah.
didn't know that this was here, and I thought that I could pay with this and that. Like, a lot of old people that were old guys, basically,
Hmm.
that
Hmm.
were being
Hmm.
angry with these ladies that
Hmm.
were just doing their job. And so it's funny how sometimes that pays off by just being able
Yeah.
to
It's
control your emotions.
it's really interesting too, because there was another layer to the story, which is ironic, which is this. I didn't know they couldn't find the boxes till after I physically checked out. And so I went to the front desk,
Oh.
and this is a hotel I don't have a lot of status in or whatever. So I don't like 80 million apps. And so I, checked out. And the woman who checked me out was lovely. Well, then all this starts happening, and I go, I need to talk to the GM of the hotel.
Hmm.
Well, guess who was the GM of the hotel? It was the same woman who checked me out.
Oh my
I
gosh.
had no idea,
Yeah.
right? And she was just a really nice woman. And at one point, because I've had experience with this before, actually, it was a GIDE course in Miami eons
Uh-huh.
ago where we shipped stuff in and the hotel claimed it wasn't there and they let me go back to the storeroom. I'm like, there they are.
That's it. Yeah.
And so the bellman wouldn't let me back, but she did.
Mm.
And I looked at her, I said, listen, I know this isn't protocol. And I already asked the guys, I was like, can I please just go back there? I said, maybe they're sitting there and we don't realize it.
Yeah.
She's like, okay, come on. And
Yeah.
so, again, she said to me a couple times, she's like, you're just being so kind about this. I'm like, look, you didn't do this on purpose. You're just trying to help me, etc. So when you have those difficult patients, just remember that you have a choice how you can react. You know, did you have a bad day or did you turn 5, 10, 20 minutes into 24 hours? You have a choice how you're going to react to it because their reaction is not a reflection on you, particularly if it's someone that you have a newer relationship with, right?
Hmm.
And I think the other thing I'll say too is like, especially if you're, at least a couple years out of practice, if your spidey sense is going off that this person's going to be difficult, then listen to it, please, because you know
Yeah.
damn well you're going to be right, right?
Yeah, and I'll tell you that is a learned skill too.
Oh yeah,
Because I remember difficult patients that I would be having a new consultation with, and my partner Mark, who is 20 plus years older than
yeah,
me, would walk by and then catch me in the back office and be like, "Hey Kyle, I don't think I would do that case." And
yeah,
I'd be like, "Mark, that's like a $20,000 implant,
yeah.
and like I could it's an easy case for me, like that's bread and butter for me."
Mhm.
And he'd be like, "Yeah, he or she sounds like really difficult."
Yeah, yeah, yeah,
And that was unknown unknowns for me.
yeah.
I was doing the best with the skills that I had at the time, but I
Yep.
didn't have very many skills besides clinical skills. I
Yeah.
did
Well,
have
you
clinical
learn.
skills, but I didn't have all these other skills.
Yeah. Yeah.
So, in summary, what do you think about the mental game of difficult patients?
I would say that you will win this game when you don't play it. And what I mean by that is being curious, not judgmental. Being curious means also not jumping to conclusions. Um, and not allowing somebody else's behavior to dictate yours
Yeah,
at the
so
end of the
that I was thinking about that as living between the stimulus and the
day. Yeah,
response,
totally. Totally.
focusing on what you can control, not what you can't control.
Yep. Yeah.
And then I would also say having the mindset that not every patient is right for your practice.
Amen. Yeah.
Yeah. So all of these concepts Martin and I talk about in our online courses, especially our 2-day Lightside Live program. And I'm not sure when this podcast comes out if we will have one up, but you can go to the link in our show notes and see if Lightside Live is up. If we don't have one scheduled, there is a wait list. And so
Yep.
we always have people on the wait list that are waiting to come in because they couldn't make it into the last one, whether dates were due or it was already
Yep.
full. And it really is an incredible course. It's a 2-day transformational CE course. You get 12 CE credits. And we've had many people say, not just a few, but many people say it is the best CE they've ever
Yep.
taken in their entire career.
Yep.
So don't want to toot our own horns, but toot toot.
Well, and to be fair, the multiple people that said it that they were not prompted; those were their
No,
words.
yeah.
So yeah,
Hmm.
yeah,
All
yeah.
right. Well, we hope you guys enjoyed this. We hope you got a ton of value out of this episode, and we'll see you on the next episode of Wellness and Dentistry.
Take care.